We actually live in a bit of a sort of a social media world now, which is all through a screen, yeah, and you end up partly having a lot of fear that comes through the media of just all these, you know, all the terrible things that are happening in the world, and often you don't get the good stories coming through. In a world that sometimes got quite a lot of sort of doom and gloom about it, there's a positive message at the centre of this, which is there's a wonderful life to be lived. You know, diseases happen, but we can beat them, we can overcome them, and I just love being part of that message.
So we got some articles on the table now to talk about ourselves, our life, shall we say, and what we've done. So we'll start off. We'll go right back then to great gran. She died at a very young age of bowel cancer, and we're certainly talking in her 40s. It's a family history, really, of bowel cancer. My great gran died of it. My gran died of it. My father died at 46 years old of it. My sister was diagnosed at 26, and I was diagnosed at 26 as well. My daughter's 13 years old now, and she's been just genetically tested, so she's got the gene as well. So at some stage in her life, she will end up getting bowel cancer. If my daughter never had it, that would be the end of it. Her children wouldn't get it. However, that's not the case because we have such a strong gene within the family on my dad's side. Therefore, the interest is raising awareness more than anything.
It's such a taboo subject. Like, people don't want to be talking about their bowel habits or nothing. So I think the more open we are, the better.
Often it's a sense of fear of the result being in any sense positive. It's not an easy thing to handle.
It's very simple, but sometimes it's emotionally difficult.
I would definitely say that if you're a bit more of the shy type, it's a matter of between you and your doctor, and that's all it has to be. You don't have to have anybody else involved in it. I'd say it, and this is the way I tell people, it's a couple hours of inconvenience for a lifetime of fun.
Bowel cancer is the second most common cause of cancer-related deaths in the UK, and this is particularly upsetting as we know that over 90% of bowel cancers can be treated effectively if they're picked up early. So we're faced with a statistic that we know we could do something about if we had more effective ways of picking things up early. I'm often struck by the fact that they're worried and embarrassed for me. And I'd really like to reassure people that as doctors, this is the bread and butter of our daily work.
Can I stand here and have a conversation with you about these kind of awkward matters? Can we talk about what symptoms you've actually got, or do we want to get embarrassed? It's in people's hands. If they have some symptoms that are pretty obvious, I had stomach cramps.
Any blood in the stools.
Sudden weight loss that you can't explain why.
There's only one thing you do. You go and see your GP.
We are much happier seeing and investigating an early symptom, and we're used to all forms of examination, things that may seem very intimate. Really, for a doctor, there's no embarrassment because this is what we were trained to do. This is why we have 5 years of clinical and preclinical training.
In what can be quite an isolating diagnosis, there's people out there that really understand what you're going through. And small charities like BCW have really got one message to tell, and that is a positive one. It's one that can be, yes, bad things do happen, but given the right treatment and the right support and the right funding, then lives can be saved.
I have off days. I have days where it's not pleasant. But those days that are very good far outweigh the unpleasant days. So life's fantastic. I've got to be honest with you, at the moment it's fantastic. So therefore it all stems from getting checked out, and if you're not happy, get a second opinion, and that's exactly what I did, and that's why I'm still here today.